good morning and welcome. It's my pleasure to be here this morning. My name is Michelle Moran. I'm Chief Executive of Humber NHS Teaching Foundation Trust. We've got an absolutely full-packed agenda and I'm really looking forward to listening to the speakers. I am Chair of the Clinical Research Network for Yorkshire and Humber, so there's really something here for everybody.
So Dame Sally, by the stroke of a pen, made sure that we had R&D approval within 72 hours notice for this protocol. These protocols and the concept have been adapted and adopted now in 52 other networks of infectious disease doctors and intensivists in 133 countries.
And so far we've recruited 469 out of 600 participants, and 28 of those have been from Humber. I think we had an initial target of 20, so a kind of smaller trust but still pretty impressive. 13 of those have gone into the intervention and 15 into the control group. And I think another great thing about this study is we've trained at least 11, could be more now, social contact coaches in the intervention, and hopefully that has a knock-on effect on the work that we do in local services.
Personally, I've really enjoyed being involved in this piece of research alongside my role as an assistant psychologist. It's been really feasible and easy to manage alongside my schedule, and I'd encourage anybody who works in the Humber Trust or wider just to get stuck in with research. And this team have loads of other projects on the go, so just contact and get involved.
So we know there's now clear and consistent evidence that exposure, so being in green and blue spaces, is associated with mental health benefits at both population level and in individuals. And I guess this is nothing new, so if you think back to the kind of Victorians, they quite frequently took the air, went on promenades, kind of bathed in the waters. So this isn't anything particularly new. However, the research is really focusing on this now.
We know that when people do start treatment for our service, and this is internationally, the evidence shows that it reduces deaths and improves outcomes significantly. People get back their family, they get their jobs back, education, so many health benefits in terms of treatment.
This is a celebration of research over the past year. It's been a very different year for all of us. We've had to adapt the way that we've done things to make sure we can still offer the benefits of research to people. We're celebrating research and how we change lives.
Really, the project wanted to show that research is something that's for everybody. It can be fun and rewarding, and it's definitely not something to fear. And we also wanted to be able to engage our trust service users, but also to empower clinicians who maybe didn't feel very confident about starting a conversation about research. So in that way, the video could become a tool for them.
And I think we've picked up on some of the ethnic diverse groups that we have within forensic services, and I think the staff highlighted this, that we'd all love a fabulous service that greeted every form of diversity of human being. As we know, mental health patients don't fit a box, nor should they fit a box, but these specialist provisions and specialist services aren't always available within our local area.
We're working on closed loops, and I'll finish with that. That's the artificial pancreas that we talk about. And can you imagine a child, 5 years old? What is the main thing that parents tell us? I have to stay awake at night because I don't know when she'll go into a low blood sugar and what will happen at night. I just stay awake. I'm scared. What does closed loop do? It takes it out, gives the parents sleep. So we're doing a trial across the country. Do you know what's the feedback from parents? I can sleep. That's a simple. You don't need any other metric to improve. You have improved the quality of life.
Diabetes care for people with severe mental illness really shouldn't be any different to diabetes care for people without a severe mental illness, because the NICE guidance recommends that everyone who receives a diagnosis of type 2 diabetes is referred to a diabetes education program. Now, it doesn't say exclude people with severe mental illness.
I mean, what comes across time and time again in the data is that if locums don't perform well, or if they are perceived to be problematic, what organisations tend to do is simply to terminate the relationship and do nothing much more about it. Now, you can understand that, but actually that's a real problem for the NHS as a system, because then that doctor may simply go and work somewhere else. And locums complain that they don't get feedback on their performance, that they're not helped and supported, that in a way they're a bit set up to fail by organisations.
And really our main objective is to develop and test 2 new interventions, one aimed at family carers and people living with dementia in the community, and one at paid home care professionals, kind of on the front line working with people living with dementia.
So what we are doing is trialling 4-week waits in across community mental health, and our aim is in the long term is to get to the point where people can get timely access for all mental health treatments.
Someone said to me from it's a group called HACA, I think the whole Afro-Caribbean Association, and she said this, she said, Margaret, often when we're approached by research entities or organisations, it's with our own agenda, but no one actually asks us, what does this actually mean to you? And I found that was a really profound statement, and it's something that we really do need to explore a lot more.
Really grateful for all of the speakers who've joined us over the last couple of days, and I'm really appreciative of the trust that the support it gives to research, not just through income but actually just being here in the room and recognising its importance, because I think research is a team sport. So with that note, Caroline, I'll leave the floor to you, and thank you.
I think a really important message to get across, both to some of those who work within our community but also our patients and their families, is that research isn't something to be feared. Some clinicians may hear that word and think it's all about dusting off the statistics manuals and finding lots of extra time. Patients might think it's all about people in white coats and testing new drugs. I think we've had a flavour today of how diverse the opportunities for research are and how importantly inclusive they can be too.